Hi, my name is Katie.
Hi, my name's Abby.
Hi, I'm Lindsay.
I'm Bailey. Today we will be discussing the topic of puberty in the school-age child. We would like to discuss first signs of physiological changes associated with puberty, how to manage physical changes that happen during puberty, Tanner stages and hormones, and psychosocial changes and challenges associated with puberty. Let's begin by highlighting the first signs of physiological changes associated with puberty. First, there are several terms related to puberty that are important to know. Gonadarchy refers to glands secreting hormones related to the very first signs of puberty. The secretion of these hormones are what trigger puberty to begin. Adrenarchy refers to physiological changes that begin to occur related to androgen. Examples include body odor and axillary hair. Thelarchy is the beginning of breast development in girls. Menarche is when menstruation occurs for the first time. Spermarchy refers to when sperm begin to be made within boys. Pubarchy is a term that references the first sign of pubic hair. Now that we have covered some basic terms, let's discuss early or precocious signs of puberty. According to the American Academy of Pediatrics, precocious puberty usually occurs before the age of 8 in girls. The American Academy of Pediatrics also cites that African Americans and Hispanic girls are more prone to precocious puberty than Caucasian girls. Signs of precocious puberty include early menstruation, occurring a couple years after breast development. Precocious puberty in boys usually occurs before the age of 9. Signs of precocious puberty in boys include enlargement of the testes, muscle development, body hair, and voice changes. The American Academy of Pediatrics explains causes of precocious puberty in both boys and girls. One possible cause is premature adrenarche. The adrenal glands produce weak male hormones, androgens, at an earlier age. Another cause is peripheral precocious puberty, and although uncommon, is due to the ovaries and testes working earlier on their own. Also, an abnormal pituitary gland function, central precocious puberty, can cause early puberty. Puberty can occur earlier than usual, although it may also be delayed. Delayed puberty in girls is defined as breast development that has not begun by age 13. There are several causes of delayed puberty, and they may include decreased body fat, and this is sometimes seen in young boys or girls that participate in gymnastics, swimming, or dance, anorexia nervosa, or primary ovarian insufficiency due to damaged ovaries or undeveloped ovaries. Causes of delayed puberty in boys could include constitutional delayed puberty, and this is more common in boys than in girls. It's inherited from the parents of the child if the mother or father was a late bloomer. According to UpToDate, normal signs of puberty in girls include breast enlargement, and this is the first sign of puberty in girls, growth of hair on the legs, underarms, and in the pubic area. Menstruation typically begins a couple years after breast enlargement and hair growth. The onset of menstruation varies depending on multiple factors. Vaginal discharge is normal at this time, and it is usually clear or white in color. Also, according to UpToDate, in boys, the first sign of puberty is enlargement of the testes. Growth of hair under arms, on the face, and in his pubic area occurs. Voice changes and enlargement of the penis also occur. The breast tissue can enlarge, however, this is usually only temporary in boys. Now that we've talked about the physiological changes associated with puberty in boys and girls, Abby is going to talk to you about how to care for yourself as your body changes.
Hi, I'm Abby, and I'm going to be talking to you about some of the tools that I have here to help with the physiological changes of puberty. So as Bailey already discussed, you have the things such as increased sweating, hair growth, acne, all those kinds of struggles that you may be faced with. And here's what we're going to do. We're going to talk about it. So I had the boys over here and then the girls right here. And some of the stuff happens for both boys and girls, such as brushing your teeth. You should be brushing your teeth twice a day at the least, if not more than that after every single meal. Alrighty, next thing that's kind of the same for boys and girls is brushing your hair. You should brush your hair every single day. And since we're talking about hair, you should be washing your hair every single day for men if you want, or every other day for women if you choose. Shampoo and conditioner. Because a lot of those sweat and gross stuff can kind of collect if you don't wash your hair. Alrighty, and then body wash and face wash. To decrease the risk of getting acne and clogged pores, you should be washing your face every single day. Alrighty, big scary topic with the increased hair, shaving. So we got some women's shaving cream and some men's shaving cream over here. And you should always shave with the growing hair, not against it. And so you have your razors right here, and for men, you can either shave your face or wherever you just don't want your hair. Honestly, it's up to you. Don't tell anybody where and where you can't shave. Do what you want. Alright, next we're going to talk about skincare. Your skin kind of gets a little oily or could be dried out because of the hormones and the increased sweating and everything that's changing. So lotion. Put your lotion on after you get out of the shower. Simple as that. Next, for women, this is a big change. Menstruation. So I have some tools here that you can use. Your choice, doesn't matter. I have tampons right here and panty liners right here. And the tampons, as you know, you kind of place inside the vagina and it absorbs your menstrual bleeding. And then the panty liners sit right on top of the underwear and it collects the blood as well. And you should be changing these as directed on the box. Alright. Increased sweating means smell. I'm telling you, you gotta use deodorant because it'll decrease the smell. Just gonna leave it at that. Use to wash your body. Alrighty. So because everything's growing, you need to understand that your fingernails and toenails are going to be growing at a rate as fast as your hair almost, if not faster. And you should be clipping them regularly to decrease the chances of ingrown toenails and ingrown fingernails. And it can also decrease the spread of infection if you keep your nails at a shorter length. Q-tips for cleaning out your ears. Got mucus, or not mucus, wax. I'm just going to call it wax. I'm not going to bore you with the medical name, but wax that you should be cleaning out of your ears. I mean, ideally you shouldn't be putting anything smaller than the size of your pinky in your ear, but yeah. Spread of infection. I got tissues here and I got hand sanitizer. Use them. And next, this is a fun time in your life because you're finally transitioning into an adult, kind of. So enjoy it while you can, and don't be afraid to ask questions if need be. And then according to Up to Date, you should be having the puberty talk with the adolescents, school-age child before puberty even starts so that they know what to expect. So now that I've gone over the tools and how to take care of your body, let's talk about why this happens in the first place. So Lindsay is going to talk to you about hormones in the Tanner's stages, which will give you some more insight on what's happening in your body.
Hi, I'm Lindsay, and I'm here to talk to you about the hormonal changes that happen during puberty and what those hormonal changes do to your body. So puberty is a strange transitional time. The majority of the time when you ask questions, the answers are brief and deal with the signs of puberty. But why exactly are all these changes occurring? What is happening inside our bodies, and what exactly do these internal changes do externally? The answers to these questions have to do with both the endocrine system as well as the physiological changes that occur. The endocrine changes leading to the physiological ones, to be exact. So let's dive in. The endocrine system is a system of our body that works alongside the nervous system to regulate the activity of our cells. It does this through the use of hormones. Hormones are the messengers of the body. They tell all of your body parts what to do and how to react to certain stimuli. The hormones that are involved in puberty are progesterone, estrogen, testosterone, follicle stimulating hormone, abbreviated FSH, and luteinizing hormone, abbreviated LH. The messages sent by these hormones lead to the physiological changes that happen in the body during puberty. Now that we know what these hormones are, what exactly do they do? Well, let's start with FSH and LH. Both FSH and LH are released into your body and trigger the beginning of puberty. So these hormones trigger a release of more hormones, which lead to the changes that you see in your body at this time. And progesterone, estrogen, and testosterone are the sex steroids. So estrogen is the primary hormone associated with female puberty. So that is why you're seeing changes in your body such as breast enlargement and the beginning of your period. And testosterone is the hormone associated with the beginning of male puberty. So testosterone will trigger the growth of male genitalia and also a lot of other changes that occur in your body during puberty. So now that we've discussed the changes inside of your body, let's talk about some of the changes that occur outside of your body. So puberty is often defined by the 5 different Tanner stages. So let's talk about what the Tanner stages are. The Tanner stages range from stage 1 as prepubescent, which basically means that your body looks the same as it did when it was a little kid. And then stage 5, which is fully mature, which means that your genitalia will appear adult-like. So really, what we should focus on are those in-between stages. So in stage 2 of the Tanner stages, for females, there's the development of breast buds. In stage 2 for females, there's the development of breast buds, which is an elevation of the papilla and enlargement of the areola. And then there is the development of pubic hair along the lateral vulva. In stage 2 for boys, there is a small amount of pubic hair that begins to grow around the base of the penis, and then the testes and scrotum enlarge, as well as the scrotum becomes a red color and gains different texture. In stage 3, which is the middle of the Tanner stages, in females, enlargement of the breast bud continues, as well as the areola, but there's no separation by a contour anymore. And then pubic hair begins to get darker, coarser, and curlier and start to cover the mid-pubis. In stage 3 for males, pubic hair begins to get darker, coarser, and curlier and starts to cover the mid-pubis as well. And the penis enlarges and there is further growth of the testes. And in stage 4 of the Tanner stages, the areola in the female and the papilla begin to project above the breast bud, and pubic hair is adult-like but has not extended from thigh to thigh. In stage 4 for males, pubic hair is adult-like but has not extended from thigh to thigh, and an increase of size in penis breadth, testes, scrotum, development of glands, and the further darkening of the scrotum occurs. So, now that we've talked about the hormones and the causes that Now that we've talked about the hormones that cause these changes, Katie is going to talk to you about the psychosocial changes and challenges associated with puberty.
According to UpToDate, puberty maturation has an impact on psychological and social issues. The cognitive development of children in the school age is not affected by puberty. However, psychosocial issues such as body image have been a strong variable. Body image is a sensitive subject for girls as they enter and finish puberty. In contrast, a boy's physical appearance and mood improves throughout puberty. Additionally, puberty may have an especially negative impact when a lack of synchrony between the timing of puberty and chronicle age exists. For example, the early maturing girl may experience a greater decrease in self-esteem and body satisfaction when compared with on-time or late maturing girls. Girls are more likely to experience oppositional disorder and attention deficit disorder. In comparison, boys that are late to mature are more prone to experience emotional reliance and internalizing their behaviors. There is evidence to support an increased risk of participating in risky behaviors in association with precocious puberty in girls. In the school-aged child, they start to experience Erikson's psychosocial stage of industry versus inferiority. Children need to cope with the new social and academic demands. Success leads to a sense of competence, while failure leads to a feeling of inferiority. The important events that determine whether a child in this stage feels successful are school activities and peer interactions. Children in this stage wish to be productive, and without being encouraged to succeed, they can feel unmotivated. Conflict begins to result in what they shouldn't and should do in order to gain adult skills. Motivation is key for children to keep wanting them to learn, practice, and succeed in all they do. There is a psychological effect that hormones exert on the body. Changes in mood are evident throughout puberty, and children should understand this as completely normal. The best and most effective way to manage these emotions and feelings are through language expression. Starting the conversation with a trusted adult is a great way to get in the habit of expressing emotions so that it doesn't feel too overwhelming. Remember that puberty is a normal process, and trusted adults and peers are here to help you. It is okay to feel embarrassed by the changes that are happening in your bodies. However, you are not alone. If you or someone you know has expressed feelings of inadequacy or that they don't feel they are good enough, be sure to contact a trusted adult so we can talk about it. We hope this video gives you an idea of the first signs of physiological changes associated with puberty, how to manage physical changes that happen during puberty, Tanner stages and hormones, and psychosocial changes and challenges associated with puberty.
Thanks
Thank
for
you.
watching.